The field of radiologic technology, as a title, might make you think of having a broken bone and going to have x-rays taken so the doctor can properly set the bone. Or you may immediately think of radiation as a bad thing. However, there are many diversities to this field, such as MRI, echocardiology, CT scan, mammography, and sonography are all included in radiology. We are going to focus on sonography. Sonography or ultrasound is defined as a non-invasive technique using sound waves or other vibrations having an ultrasonic frequency, producing a two-dimensional image used for the examination and measurement of internal body structures and the detection of bodily abnormalities. The history of ultrasound began in 1794 when physiologist Lazzaro Spallanzani was the first to study echolocation among bats, which forms the basis for ultrasound physics. In 1877, Perry and Jacques Carey discovered piezoelectricity. The piezoelectric effect is how ultrasound transducers emit and receive sound waves. In 1915, Paul Langevin invented the hydrophone, which is a device that detected objects at the bottom of the sea, after he was inspired by the sinking of the Titanic. In 1942, Carl Dusek is credited with being the first to use sonography for medical diagnosis when he attempted to detect brain tumors by transmitting an ultrasound beam through an human skull. In 1948, George D. Ludwig developed the A-mode ultrasound equipment to detect gallstones. From 1949 to 1951, Douglas Howry and Joseph Holmes are the leading pioneers of B-mode ultrasound equipment. John Reed and John Wild invented a handheld B-mode device to detect breast tumors. In 1966, Don Baker, Dennis Watkins, and John Reed designed pulsed Doppler ultrasound technology. Developments led to imaging blood flow in various layers of the heart. And in the 1980s, Kazunari Baba developed 3D ultrasound technology and captured three-dimensional images of a fetus in 1986. The purpose of ultrasound. An ultrasound allows doctors to see problems with organs, vessels, and tissues without needing to make an incision in the patient. How ultrasound works. Ultrasound or sonography is a medical imaging technique that uses high-frequency sound waves and their echoes to view organs, vessels, and tissues inside the body. All components involved in ultrasound include the central processing unit, or CPU, which, like a computer, does all of the calculations to produce an image on the monitor and also stores the processed information on a disk. The transducer pulse controls set and change the frequency and duration of the ultrasound pulses. The display turns processed data from the CPU into an image. This could be in black and white or in color. The keyboard and cursor allow the operator to add notes and take measurements of the image. The disk storage. Processed data and/or images can be stored on disk. These can be hard disk, floppy disk, compact disk, CDs, or DVDs. Printers are used to capture a printed picture of the image from the monitor. What does an ultrasound use to produce its images? Ultrasound uses high-frequency sound waves that are projected into the body, bounced off an object, back to the receiver to create an image. Common exams and information gained with ultrasound. Common exams include a baby's health in the mother's womb, bladder, brain, gallbladder, kidneys, liver, ovaries, pancreas, spleen, thyroid, testicles, uterus, and blood vessel exams. Ultrasound is also a helpful way to guide surgeons' movements during certain medical procedures, such as biopsies, diagnosis of heart conditions, and assessing damages after a heart attack. Information can be gained through ultrasound, including tumors, cancers, baby size, and health. Why might an ultrasound be ordered on someone? Ultrasound may be ordered if someone is experiencing pain, swelling, or other symptoms that require internal view of your organs. Most people know of ultrasound being used to visualize an expectant mother's unborn child. It can also visualize the brain and hips of infants. Preparation. Ultrasound requires little to no special preparation. Your doctor will instruct you on how to prepare, including whether you should refrain from eating or drinking before the procedure. Educational requirements. An ultrasound technologist should complete an accredited training program. Depending on the program, it can take anywhere from 1 to 4 years to complete. You can do a 2-year, which would be associate's degree, or a 4-year, which would be your bachelor's degree. What kind of license does ultrasound require? To be an ultrasound technologist, one must first earn an American Registry for Diagnostic Medical Sonography specialty certification. Then you must recertify every 10 years to maintain this license. Professional growth and development. The American Institute of Ultrasound in Medicine, or AIUM, is dedicated to advancing the safe and effective use of ultrasound in medicine through professional and public education, research, development of guidelines, and accreditations. And here is an explanation video.
Medical ultrasound, or sonography, is an imaging technology that uses high-frequency sound waves to see inside the body. A device called a transducer is used to produce and direct these sound waves to various regions of the body. Ultrasound's diagnostic uses are separated into 2 categories: anatomical and functional. Anatomical ultrasound is used to produce images of individual structures inside the body. Functional ultrasound builds on this, measuring things like the movement and speed of blood or the softness or hardness of tissue. This helps doctors see changes in function within a body structure or organ. Ultrasound can also be used as a therapy to treat a variety of medical conditions. For example, physicians can apply special types of ultrasonic sound waves to modify or destroy tissue. They can also dissolve blood clots and help to deliver drugs non-invasively to specific locations in the body. High-intensity ultrasound can even be used to target and destroy tumors without invasive surgery. Because of its diverse uses, safety, and relatively low cost, ultrasound is increasingly used in diagnostic and therapeutic medicine.
And then here is my reference page with all of my references.